The Centers for Disease Control and Prevention, every year about 795,000 people in the United States have a stroke. Strokes are now the third leading cause of death in the United States. So you may wonder, why do I need to know about a stroke? Because I'm too young to have a stroke. Well, according to a news release on February 24th, 2010 from the American Heart Association, stroke incidence among younger adults is increasing, where strokes among the elderly are actually decreasing. The rate for strokes for 20 to 45-year-old adults is 12 per 1,000 cases, has increased from 12 per 1,000 cases to 25 per 1,000. So no matter what your age is, stroke education is important to recognize, prevent, and try to reduce the effects of a stroke. Today I'm going to discuss 3 questions. What is a stroke? What are some of the causes or signs of a stroke? And how to prevent or treat a stroke. So let's start with the first question. What is a stroke? There are actually 2 main types of strokes, or you may hear them called cerebrovascular accidents, or CVAs. The Center for Disease Control defines a stroke, or brain attacks, is when a clot blocks the blood supply to the brain, or when a blood vessel bursts in the brain. And the main type of stroke is called an ischemic stroke. This is when the blood supply to the brain is blocked by a blood clot, a fatty deposit, or plaque. According to the National Stroke Association, 87% of all strokes are ischemic. Another type of stroke is called hemorrhagic stroke. This is when blood leaks in the vessel, from the vessel, or the vessel bursts, which causes bleeding in the brain and swelling on the tissues and death of brain tissue. These account for about 13% of strokes and about 30% of the stroke deaths. So now that I've given a definition of what a stroke is, we'll discuss what are some causes and signs of strokes. There are many causes and signs of strokes, and no 2 strokes are the same. Some of the main causes are high blood pressure, high cholesterol, smoking, drinking alcohol in excess, diabetes, atrial fibrillation, high salt intake, poor circulation, and previous strokes. Some of the main symptoms of a stroke or signs of a stroke are weakness, and it usually occurs on one side of the body, and it's opposite to what side of the brain is affected by the stroke. And then there's, you may have numbness, tingling, paralysis, slurred speech, swallowing difficulties, and visual disturbances, fainting, confusion, trouble walking, loss of balance, and severe headache with no known cause. So I have discussed what a stroke is and what are some of the main causes or signs of a stroke. And now I'll answer how do you prevent or treat a stroke. Prevention and treatment of strokes are the most important keys to keep from having a stroke or to reduce the effects of a stroke. According to the Center for Disease Control, controlling risk factors is the first step in preventing a stroke. Lowering higher blood pressure, high cholesterol, salt intake, blood sugar, and weight can all decrease your chances of having a stroke. Exercise, not smoking, or drinking in moderation are all other ways to decrease risk. Treatment for strokes takes a multidisciplinary team. There's doctors, nurses, respiratory, speech, physical therapy, and occupational therapy therapists that are involved. Case managers and social workers to help find rehabilitation or to help with assistive devices that the person may need. And patient, of course, is included, and the family. These all work together to help the person maintain function or restore functioning in somebody that's had a stroke. Treatments for strokes are very individualized because no person is affected the same way by the stroke. Some of the ways they may be treated are medications, surgery, and or extensive rehabilitation. Today I've discussed what is a stroke, what are some of the causes and signs of a stroke, and treatments or prevention of a stroke. I hope the information that I've given you today will give you a better understanding of strokes and why it's important to know about strokes. Strokes affect people of all ages, race, and backgrounds, so if you would like more information, please visit the websites of National Stroke Association, the American Heart Association, and the CDC. And also visit with your doctor if you have any health concerns.